I chose Sister Roy Callista's adaptive model to explore how stress amongst nurses affect them. Work-related stress in nursing environments is a significant issue that must be addressed. In a survey conducted by American Nurses Foundation, 2021, 34% of nurses reported their emotional health was not healthy. Out of nurses who said they planned to leave the field in the next 6 months, 48% said their job was negatively affecting their health, and 41% said the reason was because of poor staffing numbers. The reported numbers of stress related to nurses' environment are staggering and call for action. Another factor is staffing inadequacies that cause stressors to the work environment and negatively impact the stress experienced by nurses. According to Chen et al. 2019, high patient-nurse ratios correlated with nurses' intention to leave their job. Intention to leave was related to personal burnout, client-related burnout, and job dissatisfaction. These numbers account for stress that leads them to desire to leave the profession, suffer from compassion fatigue, and PTSD. Another factor of stress among nurses is the perceived barrier of their own health promotion behaviors. Nurses are knowledgeable about the significant role exercise, diet, stress-reducing activities play in patients' lives, but do not necessarily apply these same strategies in their own life, according to Ross et al. 2019. Nurses identified being overworked or not having enough time to participate in health-promoting strategies. Another barrier identified by nurses was a lack of resources and facilities for exercise classes or gyms open during their time off. Nurses also recognized the lack of proper food storage, and reasonably priced healthy food access was also a contributing factor. Another factor they identified as being a barrier to health promoting behavior was fatigue and lack of sleep. Nurses commented that they were too exhausted from their job to be motivated during their time off to participate in preparing healthy foods or participating in yoga or meditation. Nurses also said they had been too drained to socialize with friends and family at times. That's also Ross et al. Sister Roy Callista's adoption model is focused on the person, nursing, health, and the environment. The interaction of these four concepts are inputted into the person, and then a behavior is outputted. The levels of adaptation are integrated, compensatory, and compromised. When the four concepts are well adapted and functioning well, the level of adaptation is integrated. The health and environment of the person is well balanced. When the person is challenged by the environment and is still functioning at the level required, it is the compensatory process. When the person does not have the ability to cope and meet challenges required by the environment, the person is at the adaptation level of compromise process. I think this concept is especially appropriate for the clinical question because nursing is included in the four concepts, which makes it more targeted to my population of interest. People have adaptive and maladaptive behaviors in their career. This theory will assist in exploring ways nurses can make adaptive choices in their personal life and career to maintain and improve their health promotion. In my conceptual model for coping strategies to manage stress among nurses, first, the nurse will go to nursing interventions. So it would be identify the self-concept and group identity mode. This would be assisting them finding purposefulness in the universe and their purpose or their identity in the world. Identify the role function mode. Different roles including your work, your family, and your friends. And identify the interdependence mode, which is your communication style and giving and receiving love and moral values. Next would be adaptation of stimuli. So whatever that negative stimuli is removing or decreasing the stimuli that is causing maladaptive coping. Adaptation of stimuli would be debriefing, meditation, yoga, breathing exercises, counseling, adequate sleep, focus groups, mindfulness, and communication skill training. The intervention strategies are EBP papers and peer-reviewed papers. In Zhang et al. 2020, nurses face stressors caused by their profession and will use coping strategies to manage internal and external demands. They found self-care workshops, stress management skills, yoga, meditation, massages, mindfulness, and debriefing sessions and focus groups, and also teamwork facilitated transitions reduce burnout and stress among nurses. In Lee and Cha, 2023, they found that mindfulness meditation-based programs were effective in reducing nurse burnout. However, burnout can manifest as physical, mental, or social exhaustion, and it usually requires more than one intervention to combat. Burnout is multifaceted, and the problem has to do with manpower, long shifts, and high psychological demands. In Vander Riet, they found that mindfulness meditation had a significant impact on stress on nurses and nursing students. They found high levels of stress in the workplace diminishes the satisfaction they find in their work and impacts their emotional health and their personal lives. These feelings can impact their sleep, their well-being, learning, performance, and professional growth. Mindfulness meditation is a protective strategy to increase resilience in nurses. Implications for nurses after talking about this model and stress, how stress impacts nurses in the workplace. I think a great strategy would be placing gyms in hospitals or clinics. Another option would be to have classes like yoga or meditation available to everyone that's in healthcare, but especially those who are working long hours, like nurses and physicians. And that way, if they do have back-to-back shifts, they can go to the gym before or after, which would improve their resilience and improve their quality of life and reduce stress. I thought this model was especially applicable to work stress among nurses because of the three pillars of the person, the environment, and health, especially because stress can impact the nurse from an internal source, and it can also be from an external source, such as the environment. So working with these nurses and adapting the ways that they face the world and face every patient and condition, we can try and build up their resilience so that they're not so impacted or not so impacted negatively. I also think debriefing is very important when nurses are dealing with traumatic situations or traumatic patients. This is especially important for nurses who work in the NICU or any ICU. When working with children and having deaths of children, it can be very impactful and demanding on the nurse, especially to support that family and those siblings. It's also very traumatic in a surgical ICU unit or surgical ICU. A lot of times, these are patients who are coming in with traumatic incidences such as gunshot wounds, spinal cord injuries, or broken necks, or traumatic brain injuries. And these can be out of the blue and very taxing on the nurse and very taxing the patient and their family.